Are you searching for the causes and cures for leaky gut syndrome? If so, listen on as I talk about What is a Leaky Gut by Dr. Albert Snow, holistic gastroenterologist. You can find Dr. Snow online at holisticgastroenterology.com. If you've been diagnosed with leaky gut syndrome, you may be wondering, what is a leaky gut, and how can I have one? There is much debate in the traditional medical community about the causes for leaky gut syndrome. However, there is one thing that cannot be denied. Our digestive systems no longer work the way that nature intended them to work. Why? Because our diets and our lifestyles have merged in a way that's not healthy. The result? A diagnosis of leaky gut syndrome, or one of many other bowel disorders like colitis, irritable bowel disease, diverticulitis, or Crohn's disease. But what exactly is leaky gut syndrome, and what's the best way to treat it? The small intestine, the largest organ in your body, is where 2/3 of your immune system lies. The small intestine is continuously activated when it samples molecules passing through the intestinal lining. Leaky gut syndrome refers to holes that have developed in the intestinal lining. These holes make the intestine more permeable than it should be. Consequently, toxins, waste materials, and other substances can leak out into the rest of our bodies. This breakdown of the mucosal lining is caused by taking certain medications, like antibiotics, that destroy the lining. Once the lining is destroyed, that leaves the tender skin, fat, and muscle that compromise the intestinal wall exposed to digestive acids. These digestive acids cause inflammation and create holes in the intestines. This will then trigger gastrointestinal and other problems that present with symptoms like abdominal bloating, fatigue, skin rashes, excessive gas and cramps, joint pain, and food sensitivities. Once it is started, the eating of your GI tract does not stop, nor does it go away on its own. If left untreated, the acids will eventually destroy the whole colon, and then you will have Crohn's disease, where you essentially have no remaining colon. If you seek traditional medical treatment at this stage, your physician will more than likely recommend surgery to remove your colon. Fortunately, leaky gut syndrome and related irritable bowel diseases can all be reversed and fixed without drugs or surgery. A naturopath experienced in treating inflammatory bowel disease will use natural medicines to patch up those holes and rebuild the mucosal lining. Once you're cured, you will have no ongoing maintenance, such as drugs, therapy, nutritional supplements, or dietary or lifestyle restrictions. Don't let leaky gut syndrome destroy your colon and your life. No longer ask, what is a leaky gut, but instead ask, how can I cure leaky gut? And you'll discover the answer in naturopathy. And if you'd like to get more information about how to cure your leaky gut or irritable bowel disease, visit truthaboutibd.com for our free audio.